Hello everyone, today I'm going to talk about one of the most effective ingredient for your hair growth. You might have already heard about this particular active. It is Minoxidil. So currently there are 77 studies I could find. Few are completed, few are ongoing. They are currently recruiting subjects for few of the studies. And I have gone through few completed studies on it, and I could able to find it actually gives you 30 to 40% of hair regrowth, and they apply twice daily at least for 16 weeks to see the results. Okay, and it is important that before using any product or any actives introducing into your skincare or hair care, even in your diet, I would recommend go do some research on it. Now you have access to the internet, which means you have access to some of the paper published on it, the research paper published on it. So that might help you to understand about the mechanism of the particular ingredient, and also see if there is any clinical trial has been conducted on the particular product. Okay, it's very important. Okay, coming back to the minoxidil. So in this video I have planned to explain you about how the minoxidil works and how long it takes to show you the clinical effects of it. So let's discuss about it. So minoxidil is an inactive form. So once you apply it to your scalp, it will absorb. Actually, you don't need to massage it for for 10 minutes or 5 minutes. It actually have a good absorption character, so it will absorb to your scalp. So we have an enzyme called sulfotransferase. So this enzyme actually work on this minoxidil and helps it to convert into an active form called minoxidil sulfate. So this minoxidil sulfate will help you in the overall hair growth. It is gonna mess with your hair growing phase and hair shedding phase. So that's how it is gonna work. And particularly talking about this enzyme sulfotransferase, the expression of it is varies among individuals. So that's something you should know. And coming to the how it is gonna work. So this minoxidil, I told you to convert into the active form. So once that happens, it is gonna actually shorten the telogen phase. So telogen phase is something like hair shedding phase. Okay, causing the inactive hair follicles. So it actually shorten your hair shedding phase. Then it actually helps the inactive hair follicles to move to the anagen phase. Prematurely it will move to the anagen phase. Anagen phase is something your hair growth phase, okay, or hair growing phase. So it actually pushes the inactive hair follicles to the hair growing phase. So that's how it works. And shortening of the telogen phase may introduce or induce telogen effluvium. So basically it actually shortens your hair shedding phase. What it does is it induces your telogen effluvium. Telogen effluvium is something hair shedding. Okay, like it is uncontrollably, it'll hair will shed. So initially that's what initially once you start using it, this treatment actually cause you to lose some hair. Okay, so that is common in this minoxidil action. So it will cause you to lose some hair initially, but if you continue using it for at least for 4 months, you can see the maximum effect of it. Okay, and this also actually extends the duration of the anagen phase. Okay, I told you it prematurely pushes your inactive follicles to the hair growth phase, and also it extends your hair growth phase. And lastly, actually it increases the length of the hair and diameter of the hair, the thick and the length. So it's both, it will actually increase. So this is how it works. So now you know how it helps you to grow your hair. So it is very important. And the initial effects of the minoxidil occurs approximately after 8 weeks of the treatment, and the maximum effects takes place after four months. Okay, after 4 months only you can see the maximum effect of it. And also I wanted to point out that this minoxidil appears to act on the potassium channel of your hair follicle. So this is how it works actually. So then it is also called as a hair growth stimulator. This it's a very good ingredient when you apply topically. Okay, but check with your doctor if you have any condition with your skin or any allergy with your skin. Please consult your doctor, it is very important. And also coming to the pregnant women and breastfeeding women, it's big no for them. If how you use your retinol, it's big no. The minoxidil is also a very big no for them. Don't use it if you're pregnant or if you're breastfeeding. Don't use it. And this minoxidil is commonly used for the patients with alopecia and the patients who undergone chemotherapy. Through that chemotherapy, they might have got this alopecia condition. So for them, it is very effective, and it has been observed that minimization of the hair loss and it accelerated the hair growth. And the minoxidil act as an epidermal growth factor on the matrix cells and delays the aging, thus prolonging the duration of the anagen, that is your growth phase. So this happens via the activation of the beta carotene pathway. Okay, so the beta carotene pathway, it's actually activation of it. Through that pathway it works, and it's actually prolonging your hair growth phase. So this is how it works. Now you know about it, and please do some research even on it before using. And I'm telling you that once you start using it, you can see that telogen effluvium, that is losing your hair initially, that will looks abnormally. You will lose your hair. So don't afraid, don't panic on that time. Keep using it. After 4 months you can see the maximum effects. After 8 weeks you can see some results, but wait till 4th month. After 4th month you can see the amazing results from it. So thanks for watching. This video is all about educating and knowledge with health. So keep watching. If you want any particular video I could make on it, and if you have any comments, please leave below. Thanks.